Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
Welcome everyone. My name is Raquel Maris. I'm an occupational therapist and a project coordinator at the European School of Lifestyle Oncology. Today, we're joined by Meghan McHugh. She's a manager of the lung cancer screening program at Advocate Health. She is an oncology certified nurse with expertise in patient advocacy, program development, and multidisciplinary collaboration, and has contributed to multiple initiatives in cancer care. Thank you for being here. Welcome, Meghan.
Thank you. Thank you for having me.
Meghan, I would love to start by hearing a bit about your journey. What first drew you into this field?
Yeah, I mean, it's cliche, but everyone's impacted by cancer. You might know someone, or maybe you are that someone. But given this, so little attention is given to cancer and oncology within nursing school. And so I really wanted to learn more. I think the field is just so huge. There's so many opportunities. And I have a love for learning. So I wanted to know more. Medicine is always changing. I feel like I learn something new every single day, and it keeps my days interesting, keeps me motivated to help the patients that we serve. And so that's really what drew me, is just wanting to know more about something that I didn't know a lot about.
I get that because I am also like that. And what was the transition from direct patient care to managing a multi-site screening program look like?
Yeah. I'd be lying if I said I was ready to leave the bedside. I'm not sure that anyone truly is ready. I enjoy connecting with people, and but I've had some really amazing mentors over the years, and leaders that were probably seeing my future better than I was in those moments. And so that confidence and encouragement is what pushed me to take that next step, to lead a different group of people, right? Instead of making those connecting with the patients, I'm connecting with people that I lead. And so that was really exciting, to make an impact on a larger scale and to help those at their bedside do their jobs even better. And it's fulfilling to see the impact we've had on mortality and quality of life for those people.
Thank you so much for sharing. And I can say that it is truly inspiring. And you are the person who is showing that nursing can grow into leadership and public health impact. That's so nice. How do you explain to someone that is not aware the importance of lung cancer screening?
Yeah, it's important to put it in a context that is common. So, maybe there's someone that's going to their annual visit every year, and they're getting their annual mammograms, and we put it in the context of, hey, it's no different than doing these annual checkups that you need to do for your whole body. Screening your lungs is the exact same thing. But maybe they haven't been to the doctor in a really long time. Maybe they have a fear, a mistrust. And so putting it into a context outside of the healthcare system, such as an oil change. You're going to take your car in for those oil changes regularly throughout the year, and they're going to do a check on your car and make sure that nothing's broken, or take care of the things that maybe are broken, before it leads to a major car accident, right? And it totally wrecks your life in that moment. So it catches those issues before it becomes serious. And the same could be said for the costs. Catching a cancer early or taking care of your car early on can have major cost benefit to both the individual as well as the healthcare system. So trying to put it into context that's familiar to them is usually what helps the most, followed by some kind of data point, usually.
Well, I love that comparison, and it really it turns it even more easier to understand and to be aware that it needs to happen. You need to take care of yourself, and you need to look up if something is happening or if something can be happening. And but I imagine there are still a lot of misconceptions and stigma around lung cancer. What do you hear most often, and how do you approach those conversations?
Yeah, stigma is huge within the lung cancer community. It it's kind of one of those cancers that sometimes people feel is self-induced. I smoked and therefore I deserve this cancer, and nobody deserves cancer. There's not a single soul on this planet that deserves to have a cancer diagnosis. And, honestly, it wasn't all that long ago that smoking and cigarettes were considered to be a healthy habit. Our doctors were smoking in the office visits with their patients. And so it's going to take some time to change that conversation and change those viewpoints. And it went from smoking is normal to smoking is awful. And there was very little transition between the two. So it really created this stigmatizing, conversation of it. So addiction really needs to be carefully managed and always from a destigmatizing stance. And it's a two-way road. Both people have to be traveling in the same direction when you're talking about an addiction. And nicotine is absolutely an addiction, and making sure that both people are having the same conversation and have the same end goals. Because you might not always be on the same page as someone that you're trying to help quit. The other major topics within lung cancer is fatalism and nihilism are really prominent. The idea that lung cancer is deadly no matter what I do, or I'm going to smoke because I've already got cancer. What's the point? Screening is helping to change those statistics every day, and mortality from lung cancer has significantly improved over the past 20 years. So I hope in the next 20 years, we have even more change, and curbing those conversations hopefully will happen over that time.
Sure. I just would like to touch a point that some people still believe that lung cancer is due to smoking, but we know that is not 100% true, or there is more to it. Can you explore that a little bit, please?
Yeah, absolutely. We're seeing the rates decrease a little bit for men, but within women, particularly non-smoking women, we're seeing quite a few lung cancer diagnoses that I don't know that it's totally explainable yet. I think there's still more research to be done in that space. But I appreciate the saying that anyone that has lungs can get lung cancer, right? We all have lungs, smoking or not. Certainly there's a different level of risk, but that possibility is always there. So it's not this automatic 1 + 1 = 2 moment where if you smoke, you get cancer. Particularly for women and younger women that, aren't even eligible for getting lung screening, whether they smoked or not, and or meet the age criteria. So that's a really interesting space that I think we need to learn a little bit more about why that's happening to younger women who have never smoked. So yeah, anyone that has lungs can get lung cancer. And I think that's important just to have that awareness and listen to their body and advocate for themselves with their providers.
Thank you so much for clarifying. And you were saying before that the screening can make a huge difference. Can you share a story where the screening truly changed someone's trajectory, please?
Yeah. Lung screening can truly change the trajectory of someone's health outcomes. Every time a screening is done and a cancer is found, it's going to change that person's life and change what could have been had they not had that screening. But one in particular that comes to mind, we had a woman complete a screening when it wasn't even covered by insurance yet. It was a cash price that we were offering. It was kind of new on the market, and she paid the $50 to have her screening, and it found a lung nodule. The lung nodule was eventually biopsied. Several lymph nodes were also biopsied, and they found that it was a small cell lung cancer. And those within the cancer community know that small cell lung cancer is incredibly deadly, and statistics don't favor very well for someone with that diagnosis. And there's a very low survival rate for those that receive that diagnosis. Based on statistics, she should not still be alive today, but she is. She had that cancer caught early. It was surgically removed. She did a little extra chemo just to make sure that we got any last cell that was present. And she's still alive today, thanks to that screening. She still does her surveillance scans. She's actually doing lung screenings now again, since it's been so many years since her cancer diagnosis and treatment. So it's amazing to see those stories of people that, she definitely should not be alive today had she not had that screening, and she is, and she's doing, wonderful. So that's probably the one that really sticks out in my mind. And she's just one of many that had similar paths.
That's amazing. And thank you for sharing that story. It's very touching because I had also someone in the family with a small cell cancer. So it is very nice to hear that someone
Mhm.
could power through the power of screening. That's amazing. But reaching people can still be tough, right? And what
Yeah.
kinds of strategies or community efforts have you found that really connect with the public?
hmm Yeah, we've done a lot of awareness and education tables just right in our hospital lobbies. People are already coming in. Perhaps they're coming in for another screening, and we're like, hey, don't forget about this one. So that's been, great to meet people as they're coming into our facilities already. We've also partnered with other screening initiatives such as mammography, ultrasounds, aorta ultrasound screenings, or calcium scorings. Those are very successful screenings that a lot of people have that education and awareness about. And so we tag on to those very successful, well-known screenings to say, hey, we've got another one for you. This one's also really important. And talk to us or talk to your doctor about doing this. So that's been another strategy we've used to meet the people that are already taking initiatives with their health. One of the more unique public engagements that we've done is working with our professional sporting teams in the various areas that we serve. Primarily our NFL teams that our football teams that we have. We partner with them to go to their tailgating events. So people attending the games, getting excited, getting energized before they go into that game. They don't expect us to be there. They don't expect a healthcare facility to be there to talk to them about the importance of screenings. And so it draws them in to be like, why are they there? What are they doing? And we usually have handouts or giveaways that also can draw them in. But people are excited. They're in good moods. They're in good spirits. And so it's great to have those conversations when those moments are high, and they've shared stories with us. A man came up to us and said, I just had surgery on my lungs for cancer 3 weeks ago. Thank you so much for being here and doing this. And, we've also had people who are ready to smoke a cigarette. They see us and they're like, oh, maybe I shouldn't do that. So, and then that prompts the conversation of, what are you doing here? Why are we talking about lung cancer? Why is this important? And so that's been kind of a fun, newer engagement that we've had in the public that is likewise very fun for us. It's a great environment to be in.
That is amazing. As we have spoken before, I was aware of that story, and that's so interesting. And I
Mhm.
hope many more initiatives can have those stories, because it really can help, right? Because people are just open and happy, and they are ready to
Mhm.
listen to anything that you are saying, because they are just excited and in a light mood. So they are interested in hearing what you have to say, and maybe it can change their perspectives. So that's also showing us that partnerships are really important, and the sport
Mhm.
teams partnerships can really be helpful. So having in mind these collaborations, how do you have collaborations with local organizations or public health groups helped in your work?
Yeah, they are, that's so important to drive and make the voice louder. One thing that I think is really unique about lung screening is that there's very little competition that I've experienced. We're not competing with other healthcare systems very frequently. And from a business mindset, maybe I shouldn't be saying that, but there's very little competition because everyone wants to see it become successful, become more successful than what it is today. We have very low screening rates, so we all see it as we can go up from here, right? And having that impact is what matters. So we partner with many organizations, so public organizations, government organizations, but we also partner with those healthcare systems. So learning from each other, strategizing with each other, troubleshooting what's going wrong and how can we make it better? What are you doing differently that we aren't doing? Or maybe they learn from us. And I think that that's just made a world of difference working together towards a common goal. And I think, and I hope our patients feel that too, and they hear us working together. And we're working together with another healthcare system and a major company to promote screening to their employees. And their employees have the option of where they want to go to get their healthcare, right? So knowing that they have those options and that those options are going to work together to make sure that they're taken care of, I think shows that united front of, hey, we really want to just help you wherever that can be done. But working with those organizations, healthcare systems, it brings even more awareness to whatever we're trying to promote, be it lung screening, lung cancer, education about the healthcare system in general. It makes that voice louder. It makes it more well-known, makes it maybe even less scary because it's a common voice, right? It's voices of their peers, of healthcare systems, of government elected officials. And so I think that that's really important to make sure that you put those differences aside just for the better impact of humanity.
Sure. I love the idea of one common goal and coming together to explore it. It's amazing. Have you seen any changes in public attitudes towards lung cancer or screening in recent years?
Yeah, I think definitely as lung screening has become accepted within the insurance spaces and here covered, it's covered completely under preventative care. I think that has made it much easier for people to obtain, but also to encourage because there isn't that major cost associated with it. Definitely as we've seen over the years, our volumes of people that are having screenings every year have significantly grown. So definitely that's telling us that patients are getting on board and they're coming back year after year to have that screening done, which is great. And it took some time for lung screening to catch on. It's really a relatively new cancer screening. And so, one, yes, the data was there, but then you had to convince the providers that, yes, this is the right thing to do. And it really wasn't that long ago that primary care physicians were struggling maybe with the idea, is the risk greater than the reward, or vice versa, what's right for that individual patient. And I think really now everyone's saying, yes, this is the right thing to do, and encouraging it for their patients, having those conversations with their patients to say, hey, this is really the right thing to do and important that you do that. And I think once you believe in that, it's a lot easier to advocate for that. And patients can receive that confidence in it as well. So I think, yes, the tides have definitely turned a little bit in those conversations, and people are catching on to it and understanding it a little bit more. Again, I think it goes back to those stigmatizing conversations. I think now that that's a little bit changing, now people are a little bit more willing to have the screening, learn about it, and not be, scared of it or worried what might come of those findings.
Sure, I completely agree with you. And I would like to explore it because we have touched the topic of the importance of the screening, and that is clear. But for those who might not know not know much about it, can you give us a sense of what the Advocate Health lung cancer screening program looks like in practice?
Yeah. So we're a team of nurses and data specialists. So at a really high level, our nurses are reviewing and addressing the results with patients and their providers. So that might include what's going on in the lungs, but because we're taking a picture of the whole chest, it might include things that are outside of the lungs, things we weren't expecting to find, or incidental findings. And so we're also addressing those with patients and their providers. Then those nurses are ensuring that follow-up is done. If there's follow-up that needs to take place before their next screening, we're making sure that the patients and the providers are aware of that need, helping with those orders, working with our multidisciplinary team to make sure that that's taken care of. And then our data specialists, they work in our registry and are providing data to both the team and to help tell the story. So data helps tell that story of what are we doing, what kind of impact are we having, and what could we learn from. We've talked a lot about statistics and awareness, and so those data points really help us drive those points further. Sometimes it's the data that can convince the patient. Sometimes it's explaining it in the terms of an oil change, but sometimes they need to see numbers to prove to them that this is worth their time and worthwhile. So then the team works hand in hand to accomplish that whole patient care through the lung cancer diagnosis or perhaps survivorship, or maybe it's benign and they get to go back to screening. So making sure they get to that point and whatever those next steps of care are. And that's kind of the whole picture of the team and how they operate.
It's amazing to see how collaboration is such an important part of cancer care. And as you said, you look at the whole picture and the whole person, and that is amazing. Can you explain further what the screening looks like?
Yeah. So when the patient comes in to get their screening, I usually tell them that they're going to take a longer time finding their parking spot and walking in than it does to actually do the screening. So when they come into the appointment, they're going to lay on the table for the CT scanner. And it's a long table that they lay down on with sometimes it's a circle, or maybe it's like a C-shaped machine that then circles around them. And it usually takes somewhere between 5 to 7 minutes for that whole process to take place, to get them laying down, to having the scan done, to getting them up and on their way. 5 to 7 minutes, very quick process. There's nothing inserted into them. There's no pokes or prodding. They lay down, the techs make sure that they're comfortable. They put padding or pillows or blankets, whatever they need, and to get them comfortable. The scan happens and then they're on their way. They usually get the results then somewhere 2 to 5 business days afterwards. Just kind of depends on how many screenings we're doing and how quickly they can turn out those results. But yeah, so it's a very quick and easy process. It's probably one of the easier cancer screening options out there, given that there's no pain, aside from maybe a sore back laying down for a couple of minutes, but there's no pain. There's no real big commitment. There's no diet or prep that they need to do ahead of time. It's a very simple process.
Thank you for clarifying. It's easy, it's quick, and it can be life-changing. So yes,
Exactly.
for sure, we need to give more awareness to this and let people make this choice. But how do people make this choice? How do most people end up in this program? Is it through their doctors, as you were saying before, because it is raising more awareness, or are more people coming forward on their own?
Yeah, we get however the patient wants to come to us, however they want to see us. So yes, every patient needs an order for the lung screening from their provider. So that's kind of the backbone to getting them into our program. But they might also reach out to us through our community events. We'll give them our hotline number and they'll reach out to us and say, okay, I'm ready to do my screening. What do I need to do next? And we'll help them get that order from their provider. We'll educate them on the screening, just as I've done just now, and talk to them about the risks, the benefits, and we call that shared decision counseling. And it's a component of making sure that order is placed for the right patient. And some insurance companies also require that shared decision counseling to make sure that the patient understands what they need to do, the risks, the benefits, and what needs to happen afterwards. It's a great opportunity to educate them so that they may be able to educate someone else. And it's also an opportunity to address tobacco use. If they're still smoking, it gives us an opportunity to say, hey, where are you at on that? Would you like to discuss that? Do you want some resources or some action to be done to help you, potentially with quitting or maybe cutting back? So it's a great opportunity to have those conversations, whether it come through their provider, whether it come through our community events, or maybe by them calling our hotline. So we try to go to wherever the patient feels the most comfortable. And that can happen in a variety of ways.
Sure. What are the biggest challenges for you as a program manager and also nurse leader in this space?
Yeah, I think so often we know what's in the best interest of the patient, maybe the best interest of the program, but political or business or practical barriers exist. Cost, transportation, policies, kind of you name it, at the patient level, the healthcare system level, or the government level. And it can be really frustrating sometimes to know what we would really like to do, but it's out of our control. And that's hard, sometimes a hard pill to swallow, and hard for the teams that are working directly with those patients that need that support. And so as a leader and as the program manager helping my team, whether that might be finding a common ground, or some kind of um, you know uh, I'm losing my word here. uh,
It's okay. It's okay.
yeah.
We can cut this part out. It's
Yeah.
completely fine.
Yeah. um yeah, well, anyway, we'll go back, but helping the team just find that common ground with the patient, or within the barriers that exist, and helping them with resources that maybe we do have, or trying to be creative with different things. That can be some of the troubleshooting things that I will do as a leader, or just be a sounding board. Hey, I'm really frustrated that we can't do this, and yeah, I hear you. And is there anything that we can do? And if not, let's put this on our list of a wish list someday we want to be able to do.
That's amazing. And looking ahead, what innovations, whether in policy, tech, or even in nursing practice, do you think could make a biggest difference?
Yeah. Well, just within our program, we're really excited to welcome a new technology platform that we'll be implementing before the end of the year. It's going to help us automate some of our work, improve some inefficiencies that we have. Hopefully, it'll open the door to allow us to work on some more projects, or more advocacy, or more outreach opportunities. So I'm really looking forward to that technology component that we're going to explore. But then, within policy, having different measures or metrics to be looking at around screening and smoking cessation are really needed, and certainly in development, but those things take time to develop. Having things to measure yourself against to constantly improve what you're doing is really important with us, and making sure that we're improving every single day of what could we be doing better, what could we be doing different that makes our lives easier, makes the patient's lives better, whatever that might look like. And then simplifying the eligibility criteria is another body of work, definitely at the policy level, at the government and insurance level, making it easier to identify who those eligible patients are. There's a lot of work to be done on that, and making sure that we're doing the right thing for the right patient. But like everything, it takes time, and I'm sure that'll happen over time.
I'm sure too. And I'm sure that your work will also help with that. So thank you.
Yeah.
And finally, before we wrap up, what's one message you would like to leave for our audience?
Yeah, lung cancer remains the leading cause of cancer-related deaths. It takes more lives than breast, colon, and prostate cancer combined. But it doesn't have to be that way. With early detection through low-dose CT screenings, we have the power to change that story a little bit over time. Every missed screening is a missed opportunity to detect a cancer early, and ultimately save that person's life. And we need to commit to breaking down those barriers, whatever that might be within your healthcare system, or community, and building that trust to ensure that every single eligible patient has access to those life-saving tools.
Thank you so much, Megan. It was such an insightful conversation and very helpful also to, I hope, for our listeners to be more aware of this topic and the importance of cancer screening, especially lung cancer. So thank you so much for shedding the light on this topic and for having us or for being with us.
Yes, thank you so much. This is a great opportunity to share what we're doing here.
Thank you. And I hope you have a lot of success.
Thank you.